So because this is about collective impact, I started with talking about the poverty reduction initiative that we've got going. But I've also added a piece on the youth homelessness because some of the lessons we learned from the poverty reduction we're actually able to do follow a smoother process with the youth homelessness. So our poverty reduction initiative started a long time ago. The mayor had a task force on poverty that then created a poverty roundtable, and we found that the poverty roundtable wasn't getting a lot of traction. So the municipal government, the city council, the CAO, and the United Way kind of worked together to see what we could do to take it the next step. And the Poverty Roundtable also had a 5-year sunset clause, so we had to work on making sure we captured the great work that they had done as a foundation. So the city, the United Way, and the Poverty Roundtable had representatives around the table, and we tried to look at what we needed to do. And one of the things with collective impact is that everyone has probably experienced is that it's very challenging because we all have different cultures, different methodologies, different philosophies about how to approach the same thing. And for us, one of our volunteers said that, you know, we're all driving different cars, but we're headed in the same direction. So every time we kind of came to an impasse, we reminded ourselves that we were headed in the same direction, and we had to take the time to have the conversation to work through our different approaches and philosophies and theories. It was time-consuming, and as anyone has ever mentioned to you, and that's what the advice I got, if you think it's going to take X amount of time, just double it or triple it because it'll take that much more. And I found that was true. I didn't believe it because I'm always an impatient person. I started off thinking we'd get it done really quickly, like we got all this experience from all the other communities, so we knew what we had to do. And we really had to slow ourselves down, stop, and allow the conversations to happen time and time again so that we could move forward collectively. And that, I think, is something that most of you have probably experienced in your own communities. Or if you haven't, I'd be interested in hearing about any that didn't. Like with all of you, we had a lot of community conversations around the issue from very diverse groups. We really worked hard to get people with lived experience to share their stories, share their experience, and tell us what we needed to do differently. With the youth homelessness, it was a little easier because it's an issue that there isn't a lot of work done. So while it takes a lot more thought to develop a process, it was actually easier in some ways because there wasn't a pre-established, people didn't have pre-established ideas of how we should go about it. So we were selected as part of a national pilot. Kamloops and Kingston were the two mid-sized communities selected for mobilizing local capacity to end youth homelessness. And so we recruited a steering committee and the youth planning committee, and the one that we had, and with any collective impact, the one that's most valuable are the voices of those who are impacted the most. And in this case, the youth were absolutely wonderful. Their courage, their resiliency in very difficult circumstances certainly helped frame our actions. So we're in the implementation phase with that. So I'm going to skip through this a bit just because it's just to show you the common piece. Who we selected, we needed some backbone coordinators. So with the poverty reduction, because we had so many different groups, we had 3 backbone organizations to facilitate the conversations. With the youth homelessness, we have 1 steering committee, and in some ways it's easier because we have everyone at the same table having the same conversations. With the poverty reduction, and I'm sure these are very familiar to most of you, through our community conversations, the issues that came up, which wasn't really a surprise to most people, was housing, skills development and employment, community supports for education, social service and community supports, and health. And it was difficult for us in some ways that we had to constantly remind ourselves that we were not reinventing what people were already doing, that this was not about changing the education system at this point. It was what we could do as a community to either influence or share things, but really looking externally at what we could do to support the education system, for example. We weren't going to change the hospital necessarily. It was more a practical approach to what can we do else outside of the hospitals and healthcare to look at what we could do to help that. And again, we ensure that people with lived experience were part of every group. As many of you have learned, we didn't want token representation, so we tried to make sure we had. And the number we came up with, what we heard from people, was at least 3 people who had lived experience. And it wasn't actually past lived experience, it needed to be current living experience.